Hello, my name is Suzanne Cardosi from the University of Kentucky College of Nursing. Today I'm going to be talking to you about ventilator care bundle for the prevention of ventilator-associated pneumonia. So first, a little background about ventilator-associated pneumonia, or VAP for abbreviation purposes, is a life-threatening nosocomial infection of the lungs that is directly correlated to the use of mechanical ventilation treatment in intensive care units, or ICUs. It is the second most common healthcare-associated infection in the United States, and it is also responsible for 25% of infections that occur in the ICU. In order for ventilator-associated pneumonia to develop, colonized microorganisms must be introduced into the patient's lower respiratory tract. As we all know, there are various types of pneumonia, but pneumonia is considered ventilator-associated if the infection develops within 48 hours of initiation and also 48 hours of discontinuation of mechanical ventilation. Now I'm going to talk about some of the outcomes that occur due to VAP. VAP is the leading cause of death due to nosocomial infections. It causes increased length of stay in intensive care units, causes increased morbidity, increased mortality, and overall increase in healthcare costs. Some of the factors that put a ICU patient more at risk for developing VAP are as follows. There are changes in the ICU patient's oral cavity flora. Within 48 hours of patient admission to an ICU, flora in the oral cavity transforms to include primarily gram-negative microbes, which are considered more virulent overall. The oropharynx is then colonized with potential pathogens such as Staphylococcus aureus and Streptococcus pneumoniae that, if introduced into the respiratory tract, may result in pneumonia. Endotracheal intubation, or ET intubation, interferes with the body's natural defense mechanisms. It interferes by rendering the cough reflex less effective and depressing mucociliary action. These both result in ineffective clearance of oral, nasal, and airway secretions, which may result in a pooling of potential pathogens and greatly increase the risk for aspirations of secretions from around and within the ET tube. In response to the increasing incidence and severity of consequences resulting from VAP, the Institute for Healthcare Improvement, or IHI, introduced a ventilator care bundle in 2010. This ventilator care bundle was designed to decrease morbidity and mortality due to VAP, while also improving early detection and prevention of the disease. The bundle consists of 5 evidence-based practice interventions. They are as follows. Number 1, elevating the head of the bed between 30 and 45 degrees. Maintaining an elevated head of bed has been shown to reduce aspiration and consequent introduction of pathogens into the respiratory tract. Number 2, daily sedation vacations to assess readiness to extubate and wean. Sedation vacations, in which the patient is woken up from sedation to assess their readiness to extubate, may be the intervention that contributes most to minimizing the occurrence of VAP, because it may help reduce the number of days spent on the mechanical ventilator. The longer the patient remains mechanically ventilated, the higher their risk for the development of VAP. The third intervention is peptic ulcer prophylaxis. Peptic ulcer prophylaxis lowers the pH of gastric content and decreases the production of gastric acid, thereby protecting the patient's airway from acidic exposure and inflammatory response due to possible aspiration. Fourth intervention is deep vein thrombosis prophylaxis, or DVT prophylaxis. The mechanically ventilated patient is prominently sedentary, which greatly increases their risk for the development of a DVT. It is unclear if a direct correlation between DVT and VAP actually exists. Regardless, DVT can progress to a pulmonary embolism and result in a ventilator-associated event, so prevention actions should be implemented. The fifth and final intervention of the ventilator care bundle is regular oral care and endotracheal suctioning, including oral care with chlorhexidine solution. Oral secretions and accompanying microbes can play a large role in VAP, which we have discussed on previous slides. Regular suctioning reduces the amount of secretions available for aspiration, and oral care with chlorhexidine decreases the microbes in the oropharynx that may lead to the infection. The ventilator care bundle has been shown to be effective in preventing and decreasing the incidence of VAP when all interventions are implemented together. My synthesis time was spent in the Surgical Intensive Care Unit, or SICU, at UK Chandler Hospital. In the SICU, registered nurses provide care for adult patients with trauma and critical care surgical conditions. Patient conditions include blunt and penetrating trauma, solid organ transplant, and vascular and non-elective orthopedic surgeries. Throughout my time in synthesis, I have been exposed to some incredible learning experiences, and as well had the opportunity to practice multiple skills. I have seen a wide range of patient conditions in addition to the ones mentioned above, including motor vehicle crash injuries, amputation, spinal traction, CRT, and more. The responsibilities of RNs on the SICU floor include providing total, comprehensive, and continuous patient-centered care. This care includes close assessment, documenting, implementing, teaching, developing, and evaluating a comprehensive nursing plan of care. The nurse-to-patient ratio varies from 1:1 to 1:2 depending on patient stability and need. During my time in the SICU, I was able to observe implementations of the ventilator care bundle. The first I observed was head-of-bed elevation in mechanically ventilated patients. Elevation is, for the most part, maintained. However, constantly maintaining elevation of the head of bed 24 hours a day is not always feasible. Nursing tasks such as bathing, medical interventions such as central line placement, and patient conditions or comfort are some factors that interfere with compliance of this intervention. Proton pump inhibitors such as Protonix or histamine 2 antagonists are great examples of how nurses in the SICU use and maintain peptic ulcer prophylaxis that are used regularly in most ICU patients, but all patients receiving mechanical ventilation. Sequential compression devices, or SCUDs, and heparin or Lovenox injections are utilized as effective DVT prophylaxis in mechanically ventilated patients in the SICU. Oral care every 2 hours, depending on client need, includes ET suctioning, oral suctioning, and oral hygiene with chlorhexidine swabs. There are special swabs that can be attached to wall suction to provide oral hygiene and suction simultaneously. Electronic charting in the SICU includes a VAP prevention parameter. This charting parameter serves as a reminder to the nurses to implement and also helps ensure completion of these interventions. All 5 interventions for the prevention of VAP are included in this charting parameter. The chart allows for documentation of whether the intervention was initiated or maintained, such as DVT prophylaxis. The VAP prevention parameter even includes examples of possible contraindications that would cause the nurse to not perform an intervention. For example, head of bed not elevated due to hypotension. On the left of the slide, you can see this charting parameter as it appears in the nurses charting and the SICU. During direct observation of this clinical unit, there have been no incidences of VAP and no patient has experienced an adverse outcome directly related to ventilator-acquired infection. This table that you see in front of you was compiled by the University of Kentucky Quality and Safety Committee as part of the October 2014 Enterprise Quality Close. It reflects the specific unit performance of nursing-sensitive indicators, such as catheter-associated UTI, central line-associated bloodstream infection, and of course, ventilator-associated events. Ventilator-associated pneumonia is included under the umbrella of ventilator-associated event. If you look down to the chart to Tower 2, 7th floor ICU down the left, you can see that there have been 0 ventilator-associated events for October of 2014. With this supportive data, it is clear that the nursing staff of the SICU is providing adequate care that falls within the guidelines of VAP prevention. These last two slides include my references, my nursing references, and the University of Kentucky reference. Thank you, and does anyone have any questions?